Okay, afternoon once again, everybody, and welcome to this session on challenges in low-income countries. I will be renaming our session in just a few minutes. By way of introduction, my name is Juliette Mutheu-Asego. I work at the Science for Africa Foundation. If you're in the earlier session on implementing sciences, you'd have heard one of our partners from Grand Challenges Canada, Joe Torres, talking about Science for Africa Foundation. We're based in East Africa, in Nairobi, Kenya. We are a Pan-African organization, and basically what we try to do is we're very ambitious. So we call ourselves a science funder on the continent, and essentially what we do is bring together different funders from around the world. This includes Wellcome Trust or Welcome Now, FCDO, SIDA, Gates Foundation, and then at the same time, we mobilize African science leaders to be able to really pinpoint what are the critical scientific priorities on the continent that need to be focused on. So this session is called Challenges in Low-Income Countries, but I have decided to rename it. We've been talking about solutions and impact for the last 24 hours, so I think it's unbefitting or unbecoming to start a sentence with challenges. So I think we could focus on reflections and contributions from low-income countries. This is now the new title. Alex, as you take your notes, please note that. I would like to begin with my panel members. So I am joined by Guéladio Cissé. He's the head of Ecosystems Health Sciences Unit in the Department of Epidemiology and Public Health at the Swiss Tropical and Public Health Institute. I'm also joined by Sonja Ayeb-Karlsson, and Sonja is the associate professor in policy and intersectionality at the University College London in the UK. I'm also joined by Tilly Alcayna, who's a senior technical advisor for climate and for health and climate at Red Crescent Climate Center. And to my right is Oscar Mantovani. Oscar Ceville, he prefers, apologies, Strategic Development Manager for the Americas region at Pasteur Network. Now, my panelists focus across different areas. They look at migration, they've looked at displacement, mental health. So you'll hear a lot of these topics as they introduce themselves. So now I'd like to hand over to my panelists, and I'll begin with Guéladio. Just a little bit about yourself, then your focus area, and then we'll move on to Sonja, and then Tilly and Oscar.
Thank you very much. I have to switch on this. Okay, thank you very much, Juliette, for the nice, kind introduction. So my name is Guéladio Cissé. I'm originally from West Africa, Mauritania. I'm currently professor in sanitary engineering and environmental epidemiology, head of the research unit on ecosystem health sciences within the Department of Epidemiology and Public Health at the Swiss Tropical and Public Health Institute. It's an institute of the University of Basel. I'm also affiliated as adjunct professor at the University Peleforogon Coulibaly in Korogo in Côte d'Ivoire, and associated, I can say, senior researcher at the Swiss Center for Science Research in Côte d'Ivoire, where I have been also director for some years. For some years now, I'm working on assessing vulnerabilities of water and sanitation systems to climate change and the impacts on health through those factors, particularly from extreme events. I worked on floods, extreme heat, currently the project underway. And I worked on contributing to strengthening communities' resilience in face of impacts of infectious diseases, of climate change and infectious diseases. I worked on diarrhea, malaria, schistosomiasis. And these last years on non-communicable diseases also, cardiovascular diseases when it comes to work on heat. I got the chance to have these projects conducted in Africa, mainly Côte d'Ivoire, Mauritania, Senegal, Rwanda, and South Africa. But I have also some experience of work in Asia, like in India and Nepal. So currently, the prominent project I'm involved in is the project they call the Heat Center project. It's funded by NIH. It's a co-PI and head of the team in West Africa, based in Côte d'Ivoire. It's a data science-related project funded by the NIH, as I said, and the consortium is led by the University of Witwatersrand in South Africa, Professor Mutheu-Asego, and the Sechar Center in Zimbabwe with Professor Stanley Lushters. And we are particularly looking at the impact of it on maternal and child health. This is what we call the research project 1. And the second project, the RP2, is working on the specific heterogeneity of impacts in big urban cities, and we are working on 2 large cities. It's Johannesburg in South Africa and Abidjan in Côte d'Ivoire. Last thing that I would mention about me is I have been coordinating lead author with my colleague Robert McLeman, who is in the room, who is here, of the Chapter 7 on health and well-being in the contribution of the Working Group 2 of the IPCC to the 6th assessment report that has been released last year, 2023. I think the cycle has been completed with the synthesis report. I have been also contributing authors at that level also. So this is what about me. So I'm eager to respond to some other questions.
Thank you, Guéladio. I'll invite Sonja for introduction.
Maybe now? Yeah, great, excellent. Yeah, thank you very much for the invitation. I'm very happy to be here. I'm actually going to start then by saying that I am Swedish and half Tunisian, since some people are introducing by also adding their nationality, and then I'll move on to my institute. So as you heard, I'm an associate professor in policy and intersectionality at UCL. I'm based there at the Institute for Risk and Disaster Reduction. We're taking a quite interesting approach to DRR, so we're also looking at societal risks, where I've set up a research group which is called Everyday Disasters and Violences. So besides that, I should also mention that I've been a part of setting up the Lancet Countdown, where I currently direct the mental health and well-being work, as well as the work that overlaps with migration, trap population, and climate-induced immobility. So I guess I started off my career about 15 years ago, and I was one of the very early scholars with Robert over here, looking into environmental migration. So that was at the time when there wasn't a lot of people even discussing environmental migration. I moved from there into trying to understand well-being and mental health in the context of being on the move, so people on the move responding to climatic impacts, but also looking at intersectional layers. So I spent quite a lot of time trying to understand social vulnerability of women, particularly. Spent 5 years in Bangladesh looking at gendered immobility in the context not only of migration, but also non-evacuation behavior. I specifically looked at sexual assault and rapes on the way to cyclone shelters and in shelters. And I linked quite a lot of the well-being work to a concept that many have heard, maybe in the context of UNFCCC, so non-economic loss and damage. Moving from there, I have taken a further step from the climate, well-being, migration, immobility work into the climate, violence, and health nexus, where I look at everything from migrants, trap populations, but also ethnic minorities, indigenous people, poor people, marginalized people, as well as refugees and people seeking asylum. And I think, well, maybe last, besides looking at people on the move, people displaced, and trap populations, I've also started to link some of this climate, violence, health nexus work to exploitation, modern slavery, and trafficking. I'll leave it there.
Thank you, Sonja. Quite interesting background. And we haven't talked a lot about violence in this conference, so I'm sure there'll be a lot of questions in terms of migration and violence, and then also the mental health aspect of things. Tilly, quick introduction and focus area.
Hello, everyone. A pleasure to be representing the Red Crescent Climate Centre here. And sorry that I'm going to have to turn around to be able to speak to you more easily. So I will introduce the Red Cross, Red Crescent movement maybe also, so that we're all on the same page. It is auxiliary to the government, so that means that there are specific mandates given by governments of countries to the Red Cross, Red Crescent national societies. And just as a quick show of hands, has anyone here interacted with one of the national societies in their own country yet? So this, yeah? Nice, okay, so some shows of hand already. So we are operational in 191 countries, and the Climate Centre specifically operates as almost a think and a do tank within the Red Cross, Red Crescent movement. So we support the IFRC, national societies, as well as the ICRC, as well as a whole host of other humanitarian partners, so working very closely in health and climate with MSF, for example. You may often think, oh, and I should also preface this with, so I am Franco-British, but the majority of my colleagues, in fact, only 30% of us are in Europe or North America. The great majority of the Red Cross, Red Crescent Climate Centre is operational in all other countries. And the two other senior technical advisors are based in Colombia and Burkina Faso, so couldn't travel here so easily. You may think of the Red Cross, Red Crescent more so as a response organization. That's typically what people will think. But actually there's a huge role that we play in disaster risk reduction, in resilience building with communities, and more, as we're also hearing in this conference, in that space of anticipation. And the Red Cross, Red Crescent Climate Centre was one of the very early pioneers of forecast-based financing, forecast-based action, which I'll discuss more in our orientation around solutions, where there was this large recognition of the absolutely unacceptability of the delays in financing that were happening around extreme weather events and the impacts that this was having on communities. And so pioneered this idea of, well, if we have a good enough forecast, why are we not releasing emergency funding earlier to make sure that we're able to mitigate these impacts before they hit such a large scale? So the whole idea of that, and I can go into it in more detail, is the pre-release of emergency funding on a skillful forecast. We're pretty certain that this is going to happen. That enables people to take pre-agreed actions in the lead time that is afforded. So as a concrete example, slipping in a little bit already into these solutions, the Mozambique Cyclone Early Action Protocol, it aims to prevent waterborne disease outbreaks due to, say, the destruction of wash infrastructure. And the trigger is a forecasted wind speed of more than 120 kilometers per hour at landfall. And we have 72 hours often lead time on these forecasts, so we have 3 days to do activities. And the early actions that typically would be carried out would be improving hygiene messaging, reaching communities that we know are going to be impacted, distribution of chlorine tablets, maybe buckets where it makes sense, and basically supporting communities to be able to mitigate those impacts as much as possible. So yeah, very happy to answer any questions.
Thank you. So I will move on to Oscar, who will touch a little bit about his role at Pasteur Network, and especially looking at partnerships, collaboration, and networks. Oscar, over to you.
Thank you very much, Juliette. Oscar Ceville-Mantovani. I'm actually from Panama, and I'm elated to be here. Very, very, very happy. But I'm also very, very, very nervous, actually. Because, you know, the more this meeting is happening, you know, as the day progresses, you know, my head is just like full of like information and ideas, and then whatever I was supposed to say, now I'm completely confused. I think I have a little short circuit, but it's been very interesting and very, very rewarding to be here. I'm the Regional Strategic Officer, Development Officer for the Pasteur Network, for the region of the Americas. Before that, before I've been there for a year and a half, 2 years, but before that I worked almost 20 years at a multilateral organization in Washington, D.C., dealing with environment, the different issues of sustainable development and environment, including 20 years ago there was an initiative called the Ministries of Health and Environment of the Americas. And that was one of my first jobs that I had. And I always like to tell this story because it's funny that 20 years later, this is just like, you know, it's back on the table. So this just literally, we had 2 or 3 or 4 ministerial meetings at a time just for the region of the Americas, and it was very interesting to see the ministers of health and environment getting together, and some of the issues that they were like touching was climate change and health. A little bit also focused like on environment, obviously, but it's interesting to see how it's back on the table, basically. I'm very happy to see that. And somebody was mentioning earlier today that it was the 7th meeting of the European Ministers of Health and Environment, right? So anyway, so at the Pasteur Network, as I said, I'm the Regional Strategic Development Officer for the Americas, but I also do a little bit of partnerships, and everybody does a little bit of funding, mobilization, trying to get a little bit of money to do some work. So what is the Pasteur Network? The Pasteur Network is it's a network of 33 institutes all over the world. We're located in the 5 continents. So we are trying to address global health, right? What we're trying to do is to create and to empower this community of researchers to be there with in the global conversation, to be the main, part of the main conversation. From those 33 institutes, we have 6 that are actually located in low-income countries, in Central African Republic, in Guinea, Laos, Madagascar, Niger, and Senegal. The Pasteur Network, my colleague Rebecca was yesterday in one of the first panels, and she's the one who spoke about the need to have, policy makers that are, researchers that are policy literate and vice versa. Yeah. I think we need both of those, right? So she also mentioned that we are part of the WHO. We're a non-state actor for the WHO, which just gives us access to all the information and be parts of these international meetings. So what are we trying to do at the Pasteur Network right now on how to be present and how to be participating in this global conversation on health, on public health, right? We have 3 strategic pillars right now. We're trying to deal with epidemic preparedness and intelligence, focusing basically on climate-sensitive diseases. Also trying to see from the focus of research, development, and innovation. And something that is very important to us is actually to develop a knowledge community. What we're trying to do is to create a knowledge community that it's with equity, basically, trying to make everybody participating in this daunting task that we all have right now. I think one of my mission here is to talk about, like Juliette said, what are the challenges in terms of partnership, fundraising, and international collaboration. But I think we're supposed to have 3 minutes, so I'm gonna let her ask the questions. And then I can also get like some information from one of my fellow panelists.
Okay, thank you. Apologies, my mic is not on. I'll move on very quickly to the questions. And before I do that, one of the things that I would like us to focus on a little bit, we had the opportunity yesterday to hear about the challenges and the opportunities, especially it comes to infectious diseases in countries like Italy with the reference to the West Nile virus. So just to get a sense from your organizations and from the work that you're doing, whether it's in the WASH sector, Guéladio, with your experience in sanitary engineering, infectious diseases, migration, mobility. Sonja, Tilly, you've referenced this, as well as partnerships. So Oscar, your opportunity to talk about what are the top challenges as well as solutions or opportunities to these challenges that you're seeing in these low-income countries. And I think we'll just follow the same course that we had just now in your introduction. So Guéladio, over to you.
Thank you very much. I have to open this. Oh, thank you very much again. So okay, it's better now. Mm-hmm. So you know that there are 3 major groups of infectious diseases. They talk about waterborne diseases, vector-borne diseases, and foodborne diseases. These categories are all linked in a way or another to water, sanitation, and hygiene. While in many parts of the world, progress on WASH, because it's a group, made that these infectious diseases seem to be beaten or eradicated. It's like there is an epileptic transition showing that non-communicable diseases are taking the first row in many places, but the global incidence of infectious diseases has increased significantly these last decades or over the past decades because we have some new outbreaks as COVID, cholera, dengue, influenza. So infectious diseases came back again on the agenda. They are catching more attention than before because they are also showing that health and illnesses have no borders. And climate change is affecting these, as you have seen it in many slides in the plenaries. Water matters, ecosystem systems, poor settlements, all these conditions, social factors, environmental factors are the leaders of, how can I say, the pathways through which climate change is affecting. So then, emphasis is a very major problem now. Referring to the challenges, I will highlight only three to start. The first challenge that we are facing is where you have prominently infectious diseases affecting the health system, communities, poor communities. It's where also we have a low research capacity. So the global imbalance in research capacities is leading now to the fact that published research is rather conducted on vector-borne disease that seem to be more widely a problem even in developed countries. You have the tiger mosquito, you have the mosquitoes coming up. So this is I think, one of the major challenges. So where we have the major problems with infectious disease, where people are mostly hit by infectious diseases, is where also we have a weakness in research capacity, and we have a lot of gaps in knowledge about what is happening there. But this is coming from the reality of systemic inequities in the scientific field. And when it comes to, there are two levels. There are a level of scientific research area. This is for sure, there a kind of gap. But at the level of the operational, where action should be taken, where public health action should be, ministries of health. The Ministry of Health has a kind of structural weakness to deal with the diseases that are environmental related or where the effective impact is depending on the others. So structurally, they are lacking first the capacities, the human capacities able to even liaise with the other sectors, because the building on potential of synergies with the others depend on effective, capacitated people in health sector who can undertake the necessary and appropriate work for it. I will give one example. There was one country I will not cite where the one project has been funded by the Global Climate Fund. It's millions of dollars. It's in coastal areas, coastal communities to bring their resilience, to strengthen the resilience in face of all the impact of climate change in that area, erosion, coastal erosion, winds, strong winds, and all kinds of things. Very well-written proposal, strengthening women, strengthening the mangroves in the area. So it's a very integrated project, but health component is missing. I went just to see why health is not in the program. You visit one health center in the area, you find a very courageous lady dealing with health problems, malnutrition, malaria, and so on. And then the programs is running, coming and going, nothing on health. And when I talked with the responsible person of the project, they said, we couldn't find someone coming, responding to our invitation of health to come in when we are developing the proposal. It's so simple like that. So it doesn't cost nothing to have health component around this project, but healthware was not there, and the reason they gave to me is just because we invited health people to send someone to help us to write the proposal. We didn't get anyone. So just I stopped there, just to show this is one of the major challenges that I see, how we can foster research on climate change impact of the diseases in places where it's hitting. Thank you so much.
Thank you, Guéladio. That's a good point on the representation of health researchers, especially when it comes to funding opportunities, creating or crafting research proposals. Sonja, over to you. Some examples and maybe some challenges and solutions from your side of things.
Just pressed it, it's okay. Yeah, I'll try to be brief. I have tried to summarize my time here to 3 challenges and 3 opportunities. So if we start with the challenges, I think lack of data and evidence is one challenge. But we also need to think about what kind of data and evidence that is missing. If we look from a health perspective, we still live in a world where a lot of the ways that we understand health impacts and diseases are framed around white men in middle-aged men, which is it's a challenge. So we need to really understand the intersectional layers of how health impacts certain people. My second challenge relates to the hostile and harsh political environment. And there I think that it's really important today to not only speak about low-income countries as problems being fixed in certain geographical layers of the world. But as I'm sure you're aware of, we're now looking at the Illegal Migration Act in the UK as well as the Rwanda plan. So I think we need to, when we look at displacement and movements across borders, also understand where migrants are ending up, and also think about climate change impacts and impacts to mental health and health as something that can happen when they arrive in new countries. So the living conditions when you arrive in a country such as the UK. I'll just leave a brief anecdote. So I have a new project in the UK that is looking at unaccompanied children seeking asylum. And for about 3 years, unaccompanied children in the UK have been placed in hotels without supervision. Over 2 years, around 300 children were lost. There is still 150 children missing as young as 12 years old, and many of them have been traced back to situations of trafficking and modern slavery, both child sexual exploitation as well as criminal and labor exploitation. My last challenge is that I think we need to start thinking outside of the box and try to move away from very linear black and white thinking. So I made a point today in the larger plenary about thinking about when we speak about household data, or when we speak about country data, what that data really represents. So a lot of times there's a man who represents a household, or there's certain layers of communities that represent the whole communities. So I think we need more understanding of certain layers of marginalized people, young, elderly, LGBTQ+, children, poor, and etc. So if we move on to the opportunities, I think we can go a long way when it comes to policy and legal protection. There's a lot of things. Someone mentioned equity and just protecting people better, where we see overlaps, where we can reduce vulnerability and support people in their health responses. I think we need to have better collaboration in between countries and groups. And there I really think that countries in the global north also need to start learning from countries in the global south. So it shouldn't be one-directional, but we really need to start appreciating indigenous knowledge, local-based knowledge in terms of how people are impacted by mental health, seeing changing climate around them in terms of taking in knowledge and, I guess, working against hierarchies around knowledge. And then finally, I think we need to start learning more and really appreciate interdisciplinary research. What I see a lot of times, or what I've seen over the past years that I've done this work, is that someone realizes, oh, let's do climate change and health, and then you start over from scratch. And you start collecting data that has a lot of times been collected separately at the health fair or separately within climate change or other disciplines. So I think we always need to go back and see what is there and how to extend the research rather than starting over from scratch.
Thank you for that, Sonja. You've touched on three major points that I think resonate and has come out clearly and strongly in the course of this conference. The first one is the inclusion of youth and children in the conversation. And, it's interesting the sorts of data that you're making reference to. 350 children lost is not essentially, and in the UK, it's not a small thing. That's huge. It's something that we need to pay attention to. And I really like your reference of indigenous knowledge, which we also had in plenary from Desta when she was from AMREF Africa, when she was talking about the youths, really thinking about we're not the custodian of knowledge. We get that information. We could learn from other countries and other people as well, and they don't have to be scientists all the time. And then the last point about the interdisciplinary, which I think is something we've seen in this conference, but it's also a gap and an opportunity that we can maximize on. Tilly?
I also have 4 main challenges that I'm going to focus on, but I imagine many of you feel in a similar situation of feeling like a broken record on a lot of these challenges, which is why I thought I'd gloss over them quite quickly, because I think we're all in agreement, and then focus a little bit more on opportunities. So 2 of the first challenges are to do with funding. The health sector, especially in low-income countries, massively underfunded, and then the pressures of climate change, extreme weather events are overburdening already very, very stretched systems. We did a study that also builds on WHO work to understand how much finance was coming from the climate adaptation finance to the health sector. From what we could see in a decade of financing, 2009 to 2019, less than 5% was going to sort of health-related adaptation. And when we dove much deeper into the multilateral projects, it appeared much more like 0.2% of money actually going towards the health sector. And this is likely an overestimate also. So as this room, we definitely are in agreement that the climate crisis is a health crisis, then the funding supplied is just still not matching this statement at all. So that's kind of like a big challenge, but it's also important for the humanitarian sector to look internally. And it has been estimated that about 73% of current emergency funding could actually go much more towards anticipatory action, because we know these disasters are coming. They're either cyclical or we're able to forecast them. So we could pull a huge amount of humanitarian financing in advance of the response, or to make sure that the response is not at all delayed, in order to be hugely mitigating, hopefully, or reducing the health impacts as a result of some of these climate-related disasters. We've heard it a lot in the plenary sessions of the need for more evaluations, that we actually understand what works, especially in these very complex situations where there may be conflict, as well as extreme climate vulnerability and a huge amount of issues with poverty and lack of services. So evaluation would be my other big challenge and opportunity. And then to end on this, the risk tolerance and the appetite to be able to work in these countries, to have enough long-term financing to build the health sector up, to actually address the underlying issues, remains a really big challenge. And I'm sure these are challenges that everyone could also say. So then on to the opportunities. I asked before who has perhaps worked with any of the national societies in their countries, because national societies, even though this isn't widely known maybe, operate in consortia a lot and are really involved in research programs and support. So the Climate Centre, in our role, we are involved in a number of different consortia that support the national societies as well as wider groups. EU Horizon funding, we're part of ID Alert, which, whilst it does have a focus on Europe, is also generating tools, decision support tools that could hopefully be useful elsewhere. And then ID Extremes, a Wellcome Trust funded project, which is looking at trying to improve the use of decision support tools for anticipatory action when it comes to infectious diseases. So it's a bit of a shout out. Please do reach out to your national societies, to IFRC, to the Climate Centre and ICRC about how we can advance climate health research. And there, within this, there are huge amounts of support that we seek from academic partners when it comes to understanding triggers and climate drivers of different negative health outcomes, improving, as we've talked about quite a lot, the literacy, but also how to communicate uncertainty. So sometimes it's quite difficult to know whether a tool is reliable or not, and we really rely on the academic community and wider communities to tell us what is reliable and what makes sense. A lot of help also in hotspot mapping and risk assessments to answer those questions of who is most vulnerable to what and where, so that resource allocation can go well. And so, yeah, just a huge amount of opportunity, I think, to work together on a lot of projects. Thank you.
At the risk of sounding like a broken record, I'm not going to repeat what you said. However, the key point there I took away was mainly on funding and funding opportunities. So before I go to Oscar to talk about partnerships and collaboration, there is a question, and this is a reminder. Please use Slido for the questions, and please do say your name so it's not anonymous. Our format here would be a bit different in the sense that we would like to hear your voices. There is a question, so who was the person who's put a question on Slido on international funding for healthcare facilities? You could just press your microphone and just maybe read out your question. And I don't know if Tilly or Oscar, it could be something you could cover.
Yeah, thank you for the opportunity to ask a question in person and not through IT. So I'm currently working in Rwanda, and we are building a new hospital there. And building new hospitals, I think it's detrimental that we build sustainable hospitals. That's well known, but not well supported, as we have heard. And I would be interested if there are funds, for example, available, for example, to ask for support for solar panels and more sustainable health care, because building hospitals now, meaning that they are there for the next 40, 50 years, and it's really short-sighted not to implement sustainable measures right now. I'm at a Wyman Rwanda Heart and Research Center in Kigali.
I think that's a really good question, and I'm looking at people like Joe and Oscar. Maybe you could talk about this in terms of global funding. We heard earlier from Katarina, Karolinska Hospital, University Hospital, and really for me the thing that I was very impressed about was a hospital that was really going green. Even for me coming from Kenya, I think those are opportunities that we can maximize on, and that's a fantastic question. Tilly, allow me to move to Oscar, and maybe Oscar, you could address or not address that particular question in your context.
Absolutely. Yeah, thank you. It's interesting because it's actually, when it comes to challenges in terms of partnerships, that's one that I have written down here. Besides, obviously, limited financial resources and limited research capacity, which I'm not going to go into because my colleagues actually talked about it. One of the challenges that exist for low-income countries is the insufficient infrastructure and technological barriers those create obstacles to form partnerships, basically. So I think this is something that needs to be addressed. I mean, maybe Joe can talk about a little bit of what type of collaboration, if it exists with the grand challenges initiative. I don't know if before there has been something that touches upon that. And another challenge that I want to mention is also related to policy and regulatory challenges. I mean, the low-income countries, they have different policies across countries, and that is actually it hurts in order to create partnership because they don't. No se ponen de acuerdo. They don't, they cannot. Sorry for the Spanish. They cannot, agree on something. So it's very difficult to create partnerships with that in that environment. In terms of opportunities, I'm just going to focus on two, and then I think it was Francesca earlier from WHO that mentioned that now there's a momentum and that you see a lot of stakeholders involved in this, right? You have people from the private sector, NGOs, academia, communities, the community organizations, and now she was mentioning the ministers of health are involved, which is great. But I think also it's important to involve the Ministry of Finance, I think they are the ones who actually set up the budget of the countries, particularly in low-income countries. You know, I know that in developing world is in the developed world is different, but in low-income countries it depends on the Ministry of Finance, so they need to be part of the conversation, and they need to be invited in all these in these meetings, so they know, you know, what is happening. And I think that where it comes awareness. You know, part of the challenges as well is to make people aware, not only the communities, but also, you know, the members of the government that make decisions. And another opportunity that we have is Alan mentioned that, Alan from Wellcome Trust, he mentioned that it's important to build a field of advocates and researchers. And what we're trying to do at Pasteur Network right now, very, puntual, an example, is that we're trying to create these climate and health observatories. It's nothing new. It exists in Europe. You know, I think there's a couple of, there's one in Brazil, but they don't exist in low-income countries, right? So the examples that I was giving of the 6 countries where we have Institute Pasteur in low-income countries, I think they will benefit from that. What we're trying to do is to create a group of fellows, 20 plus, that we're going to insert in several countries, in 25 countries, low, middle-income countries, and then they're going to be present there and participate in anything and everything that has to deal with climate change, and how to go to the Ministry of Health, to go to the meetings, to talk to the stakeholders involved in the country, and then they can gather all that information from different countries, say 25, and then we're going to have regular meetings so we can actually have them together and see what is, what is the same, what is different, what is lacking, what are the gaps. And that way we can start creating, so this field of advocates and get to the next step. We're not reversing climate change that way, but it's a little step. So I'm going to stop there. So happy to answer questions. I'm sorry I couldn't answer your question. But I think Joe might be able to provide an example. Sorry, Joe.
Joe, do you want to talk about the question that he didn't respond to?
I'm going to kick the can further down the road. I mean, I'll just offer 2 observations. One, I think Oscar's really right when we talk about needing to make sure that we also make this an economic development argument and a long-term economic argument. So we look at the financing that you're probably currently looking at, which is like health systems, all those restrictions. Even for us at Grand Challenges Canada, we receive about 70% of our funding from governments. We actually have restrictions for funding infrastructure. So even within our own programs, even though we're doing a health program and we know these are the right things to do, even us, we have to work to complement our funding with other funding to allow for flexibility in that, which is a silly, antiquated system because they don't want to sort of support long-term things. But at the end of the day, if you don't have facilities that are going to be amenable to those things, it doesn't matter. And you don't want to rebuild these hospitals because it's going to last 50 years. What do you need to do? So I think there needs to be a reconceptualization of how those rules are applied, one, to address things more intersectionally around climate and health. And then the second, again, is, I don't know how many economists are at this meeting, but it would have been nice to have a few more, maybe to think about how we work together to also layer in the economic long-term argument of what other kind of economic development things do we do. So some of the programs that we invest in, we call them innovation funding, but a lot of it is really economic development as well. But those benefits just are only argued on the social good perspective and not on the long-term economic benefit and gain for a community. So how do we get better about actually doing that? Because I think the real cost, if you do that, is actually much lower than we currently sort of sell it as. I think it's actually cheaper, and we're actually sort of selling it as more expensive than it really is.
Thank you for that, Joe. I know my role here is actually to pinpoint people and welcome them to speak and not speak myself. But one of the key challenges in low-income countries I want us to not forget is the issue of language. Oscar, you've made reference to observatories. I have to say, for me, if there's something I can take on from this conference, is that I have learned about the climate and health observatories. And when you said that they might not exist on the continent, I wasn't sure about that. If I hadn't seen the presentation by Desta from AMREF, I would have probably said that's true. However, given her last slide, she did reference the observatories. And Desta, this is my cue for you to just quickly, can you talk about the observatories that AMREF Africa?
We haven't really launched an observatory yet, but given the body of work that we're doing with relation to climate and health, our view and having a university, I think we're probably, I don't know, I don't want to presume, but I believe we're the only NGO that also has a university attached to it. And because we have that community linkage and on-the-ground presence, we are looking at how do we pull together an observatory that would sit within the Amref International University. It just makes so much more sense since we have the programming aspect and then, of course, the climate issue also. But I know that Pasteur is doing that as well. I know that there are many observatory plans. Ours is a very pragmatic, practical, on-the-ground response to what we're seeing. Yeah.
Thank you. Dexter, yes, exactly. And this brings me to my other point that I wanted to make, and I forgot to make. One of the opportunities that we have is to take advantage of the networks and partnerships, obviously. So this, brings us to a conversation. I'm gonna approach Desta and then talk about how we can, how we can collaborate to work in these observatories, right? So I think the plus of the Pasteur network, and I always like to say this, is because we're inserted in 25 countries in 5 continents, it provides kind of un efecto multiplicador, right? It's just once you have something that you want to implement, you can have a pilot somewhere, and then, we can exponentially create and develop that idea, be in the Climate Health Observatory or any other that deals with climate and health, climate change and health, or any other health-related issue. I think that's...
Yeah. Say, first of all, my Spanish has improved tremendously since I've joined this group. But I think it's really important to also for us to triangulate in terms of who's working on what. So, for example, when I hear about Pasteur Institute, we also oversee the R&D space for one of our biggest partners, which is Gates in Africa. So we'll be working with Pasteur, of course, but with others as well. So I think really understanding what our role is just actually to pull things together and be cohesive around some of our actions. So there's a lot of room for partnership across LMIC, Sub-Saharan Africa for us, but for others also.
Thank you, Desta and Oscar. So on that note, Alex is looking at me badly. Time's run out. David, I hope I'm saying this right. Davide, it's a quick statement, right?
Yeah, first of all, just to react to the idea of the observatory, because it's really needed, I think, to foster partnership and really to demonstrate that co-benefits are real. And secondly, from an NGO perspective, I'm Davide Ceville from Humanity and Inclusion, the new name of Handicap International. And I think that one problem is with donors because they still fund siloed sectors. I mean, DRR, inclusion, health system strengthening, mental health and psychosocial support, everything goes in parallel. It's really difficult to innovate with and piloting integrated program. And I think that we need converging policies, and they exist. It has been said in the plenary session, but also at field level, integrated programs. I think that is one driver.
Thank you for that. My sponsors, we don't use the word donors, we say funders, will not be happy with me if I don't say this. So on your point, absolutely right, the issue about working in silos. However, like I said, I work at Science for Africa Foundation, and one of the things we try and do is bring different partners together and be able to tell them in the climate and health, these are the priorities and how do we all contribute, and aligning it to their particular strategy. So like Joe has said, recently we put out a call, and it was in partnership with Wellcome, brought in Rockefeller, brought in Gates. They didn't necessarily fund, however, they were listening in, and that's always interesting to be able to bring the funders together and be able to almost give them that sort of guidance. So it is a good point, and it's one, organizations like yourself play a key role in. I'm really sorry, time's up. I will go round in reverse order. So Oscar, last parting shot in 1 minute.
Oh my God,